Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Emily Siegrist of River Hills is the Democratic candidate in the 24th Assembly District. The election is November 6th. Emily, welcome to WisconsinEye.
Thank you for doing this.
Now, on your campaign website, you say you'd like a government more interested in protections for, finish that. State government now you feel is more interested in protections for business than people. Do I have it right?
That's right.
Okay. Put some context to that, and I apologize for getting it wrong.
No, that's okay. So, I think I probably have this vision of how government should be helping people. And in my career as a nurse practitioner, I used the GI Bill to get myself through school, and I used the Pell Grant. And so I had this assistance to get myself through my undergrad as a nurse. And I think that's what the government is supposed to be, is to kind of get people to that next step so they can make it on their own. And I don't see that happening right now.
You got us right into healthcare because of your profession.
Yes.
What's the best way, now you don't really practice in a rural area, but what's the best way to preserve and protect healthcare in rural areas, please?
That's a big question. I think there's a lot of things we need to do. We need to make it enticing for healthcare professionals, whether that's a nurse practitioner or a physician or a physician assistant. And by making it enticing, it's having a community that is well supported, good schools, it's safe. Safety is a big issue for many individuals in my district. And also ensuring that it's a livable wage for physicians. They're used to kind of making something, and if they go into a rural area, they may not have that much funding. So I filled out an endorsement form with the Wisconsin Health Association, and they were talking about how Wisconsin as a state hasn't been giving as much assistance and reimbursement as they should be. And so I think that's one area we need to look at as a state, is how can we make it so rural hospitals are able to survive and not have to be supportive, here at like a metropolitan area.
So state government has a role in recruiting and retaining physicians, nurses, nurse practitioners, other medical professionals?
I think they'd probably play some small role, yes.
Small role.
And ensuring that these companies are able to get the providers that they need, because there's a few areas, obstetrics, where it's really hard to get providers. Family practice providers are really hard to get to, and that's really what rural areas need, are those professions, or those specialty. And so I think understanding what we can do to help these areas is important.
State government and Delta Dental partner in a program that subsidize dental care in medically underserved areas. Should that be a priority in the next Medicaid budget?
Dental care?
Yes.
Yes. So I would agree with that. I worked at a clinic where 75% of our patients received Badger care. And it was on 35th and Lisbon, just downtown. And, dental care was vitally important to many individuals because they never had seen a dentist before. And so, they have frail teeth, they have cavities, dental problems, and it's really important for people to get that taken care of because that can turn into a bigger infection. And so I think ensuring that people have that health care available is really important. And dental care, it's really hard to get into places. The only way you could get into the clinic here was if you saw a primary care provider like myself, and then I could refer you to the dentist there. So many people don't have that option.
As you, in your career experience, are talking to voters, are they raising the issue of caregivers? AARP estimates that there's 578,000 Wisconsin residents who are caregiving either for family members or a neighbor, someone they love.
Sure.
Is there a need for a new law or a regulation that gives caregivers more legal rights to be a part of the care decisions when someone they love is hospitalized? Has that emerged as an issue for you?
I think what has emerged for me is senior care, which is a program at the state level. And I've heard that from multiple people in my district, and ensuring that we continue that funding, that individuals have access to that. And so to go on to your question, of course, I think that's important that we take a look at that, because we're getting older, and a lot of, for instance, like my mom had to take care of my grandma, and ensuring that they have the resources in order to keep them at home until things get too far, and then they're able to get them into a facility like a senior care, Alzheimer's. That's where my grandma went. And so those programs, even though they may take some money from the budget, we've allotted some of our budget at the state level to go to other things that I think maybe was not needed. I think we should be putting it towards taking care of the people and making sure that they have what they need.
Okay, let's go to non-healthcare issues. There's an impasse in the Capitol over how we pay for highways. How would you like that impasse solved?
Well, I think infrastructure and roads is a big deal, and we're really seeing our infrastructure suffering just because we haven't really dealt with it. And it's got to be a priority. I think that's how we pay for things, is that they're a priority. Education's important, healthcare's important, our infrastructure should be important. And once again, that's going back to our community for bringing people in. So if we have good roads, people are more likely to come. So how do we pay for that? I think we've talked a few things. We looked at the wheel tax here at the county level, and that did not pass.
Did not pass.
Right. And so besides the wheel tax, we can look at gas tax. There is also the possibility of mileage tax. And so those are a couple options that I would be willing to look at to see how to get more money, more revenue come in to pay for roads.
When you hear people in the Capitol talk about tolling, your reaction?
Well, I know that, I think it might have been from Illinois, but it takes 10 years for that to kind of get built up and to get it going. So that's a long time. 10 years is a long time for us to be waiting to get some revenue back from that. So that's one apprehension I have towards it, just the longevity of implementing it. The other part is, if we can try these other things where gas tax or mileage tax can get implemented right away, and we start bringing that in, that's really not any harder, for us as the taxpayers of Wisconsin. So, we have a lot of semi-truck drivers that come through. We should start looking at that and see how hard they are on our roads and maybe, elsewhere. So tolling isn't something that would be way at the bottom.
Local governments have been living with levy limits for 14 years. Some local government leaders say that hurts their ability to provide local services. Do you think we ought to keep levy limits to control property taxes, loosen them, or get rid of them?
I'm definitely for loosening, if not completely eliminating them. And I know that our local municipalities are really struggling. I've met with village board leaders of Brown Deer and Germantown and so forth in Menominee Falls, so I know that there's things that they're really restricted on doing. And they're the ones there that are, it's kind of like nursing, like they're the ones at the bedside taking care of their residents, where at the state level, or physicians, they're kind of overseeing overall, but we're not there really on boots on the ground. So if they're having trouble, I think we need to take a look at that and ensure that they have what they need.
State government approved potentially billions in tax benefits and breaks to Foxconn. Now Kimberly-Clark wants basically the same. What are your thoughts on when state government should help a private company?
Well, we know that the tax cut helped Kimberly-Clark, and now they're asking for money from our state to stay there. And for me, that's frustrating as a taxpayer to see that when we have problems with our roads, we have problems with our healthcare system, and our education is in shambles. So once again, it goes back to where are our priorities. I understand that these are people's jobs and livelihoods, but they're really messing around with how they're taking money from the state. And I think we need to look at this a little harder, because they had such a deadline of September 30th, you need to make a decision. So I don't agree with that. I don't like how they're playing with us, and we'll see what happens.
The current budget did dramatically increase state aid to K-12 public schools. Do we need another major increase in the next budget?
I know that when Scott Walker had done some budget cuts in the beginning of his tenure, we are not back to where we should be from what he cut. And so I definitely think we should get to that point and then and take a look at where we are after that. I mean, we're educating our children, and they're our future. Like, we're going to be gone, and they're going to be taking over where we are right now. And I want to ensure that every child has the opportunity to get a good education. I don't know why it's got to be a hard thing.
Part of that debate is the voucher and the choice program that's grown so dramatically.
Yes.
Your position on the voucher choice program?
It's really hard to see our taxpayer dollars to go towards the voucher program. And the thing is, we can't sustain funding all of these options. And so we need to understand that we're going to have to kind of pick and choose how we go forth with the vouchers. Now, I understand that choice schools here in inner city Milwaukee, for residents of Milwaukee, that's their only life. That's the way they're going to get out of here and make something. And so it's really important that they have this option. And so I think working with representatives who represent Milwaukee and understand how can we get our schools back to where they should be, so they don't have to be forced to go to a choice school, a charter school, or whatever. If we had the best public schools, we wouldn't be forced in this decision making.
The debate over legalizing medical and recreational marijuana, your positions?
I think we should legalize both. Definitely medical marijuana. And being a healthcare provider, I know there's a lot of benefits, just starting with cannabis, with pediatrics who have epilepsy, and that's a key component to helping their disease. Recreational, I definitely agree with legalizing it. I think there's some tax revenue that would really help our state. And, we can take a look at California and Colorado and see how they've been doing that and making sure that we're, if there's some things we need to tweak, we can do that.
Some Democratic candidates for governor said we should work towards cutting our prison population in half. We have 2 prisons that were built in the 1800s.
Yeah, they're old.
Do we need a new state prison?
So this kind of gets tied into the marijuana question.
Yes.
And so if we legalize marijuana, the individuals that are currently sitting in prison, we need to look at nonviolent offenders and take a look at those individuals. I don't know how much of it is the population in the prison system, but I'm sure it's a lot. And take care of them, get them out, get them out and get them back into the real world. And then reevaluate who is currently in our system, our prison system. I prefer not to have to build a new prison. I think that's a lot of money. And but I think looking at all these steps before we make that decision would be vitally important before we have to decide to get a new prison.
UW system budget, tuition, resident undergrad tuition has been frozen for 6 years. The governor would like that to continue in a 7th and an 8th year. Do you have a position?
We're seeing what that has done to our university system. Superior's had to cut significant classes and programs. There's a couple other schools that have had to cut things because they don't have the budget for faculty. And, and that includes like arts and culture and things like that I think is really important to involving an individual. And so I think we're gonna have to take the freeze off. The one thing I'll say is that I think profiting off of our children's education and their future is wrong, and that's how I feel about healthcare too. This is something that they should be allowed to get to go to college if they want to go to a 4-year, they want to go to a 2-year, or they want to go to, a trade school. We should make that a priority and not putting them in so much debt where they're stuck now paying for years of schooling.
State government set aside $100 million in grants for school safety. Is that enough, or do we need to change gun laws?
We need to change gun laws.
How?
So I'm a military vet. I served in the Army National Guard as a combat medic, and I was trained on the M16. So I understand the culture of guns, and so I respect the Second Amendment. However, my daughter just started school a couple weeks ago. She's in 4K at a public school, and it really, as a mother, really scares me that what's going on in the schools. And so I think we need to look at right away background checks. I mean, that's not passed. And my opponent voted no on that this past spring, and that's something that needs to be passed. And that's a simple, 70 to 80% of Wisconsinites who own guns agree with that.
Finally, you mentioned one difference with your opponent. Do you want to highlight any others with the incumbent you're challenging?
How much time do you have?
I've only got about a minute.
Healthcare,
Okay.
Education, the environment, local control, local government. He's been a part of the 180 pieces of legislation that has passed to take control away from local municipalities. And the list keeps going on. And so, I think I understand our district. I've hit over 4,000 doors already. And every day I've committed to knocking doors until the day of election. I'm on day 25. I'll be heading to do doors after this. And it's important that I understand people's needs and wants, and that I also convey that to them as well, that, hey, I have a picture, this is how I picture that you have access to health care, that you're not going in debt and having to file bankruptcy, that our children have a good education, and that our communities are safe.
Thank you.
Thank you.
Emily Siegrist of River Hills is a Democratic candidate in the 24th Assembly District. The election is November 6th. Emily, thank you for talking to WisconsinEye.
Thank you.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.